My name is Karen Hill. I'm in Halifax. Today is February the 14th, 1984. This is the Oral History of Social Work in Canada project, a project of the Canadian Association of Social Workers. Today I'm talking with Miss Isabel McClellan, who's had long experience in child welfare in Nova Scotia. And I wonder if in order to begin, Miss McClellan, you might tell us where you were born and when, and a little bit about your early life.
Well, I have to go back a few years, Karen. I was born in 1916 in a small community in Knoll, which is on the Fundy Shore, about 60 miles from the city of Halifax, and from a family of 5 children. And early education was in the local school in that community, and high school in Truro, which is a town about 50 miles away. And after graduating from high school, I went in training as a nurse at the Royal Victoria Hospital in Montreal, where I spent just 1 year. Because of health reasons, I came home, and this was a chest problem, and did not go back to nursing, although I did some nursing at the Nova Scotia Sanatorium during the war. Mm-hmm. And from then, because I had a sister in social work, became quite interested in this field. Mm-hmm. And went to the Maritime School of Social Work in 1944.
Mm-hmm. So you've been a Maritimer from the beginning?
Yes,
hmm?
That's right.
Mm-hmm.
Yes.
Where were you during the Depression?
The Depression was from the years... part of that would be high school, mm-hmm. and part in training. And that, as far as I remember.
Mm-hmm. Do you remember anything specific? I guess possibly when you were in Montreal would have been when the Depression was at its height. Huh?
Not during, we weren't conscious of it because of our particular line of work, perhaps, and that we were students, mm-hmm. and not working in a community. Mm-hmm. You were certainly conscious that your family, your own family, didn't have that much money to have one daughter in university and another daughter in training. It meant things were pretty tight at home.
Mm-hmm. Mm-hmm. Were you working during that time while you were being a student?
No. You were just in training.
Full-time duties there.
Yes,
mm-hmm.
That's right.
And then you returned to the town that you had been born in, did you?
Just briefly, and then went to the sanatorium where I worked as a nurse for about 3 years.
And where was the sanatorium?
In Canfield, in this province,
mm-hmm.
which is in the valley.
Mm-hmm. Mm-hmm. When the war broke out in 1939, where were you then?
That was just before I went to the sanatorium. It was during the period that I had spent some time at home, mm-hmm. with my family. Mm-hmm. Mm-hmm.
Do you remember anything in particular about the war and its effect on you?
No, except you're always concerned about the people you knew who were going overseas, particularly who were close to you, like your cousins and friends, and you had grown up with. And it was a worrisome time. Mm-hmm. But it was just that I remember, the shock that you would have when you would learn of somebody being killed in the war.
Mm-hmm. Yeah, that must have been tragic. You mentioned that your sister was in social work. What was she doing during that time?
She graduated from Mount Allison University and went on to McGill and took her training there and worked in family service in Montreal, mm-hmm. before she married.
She must have had some interesting stories that encouraged you to go to social work. Do you remember anything in particular?
No, it's just that we were very close anyway, and I think I was looking for another career, and that it just sort of fell into place.
Mm-hmm. Mm-hmm. So you decided to go.
She didn't discourage me, and that helped.
Yes. Uh-huh. And you decided to go to school of social
Yes.
work here in Halifax. Yes. Then, what was it that led you to go to this school rather than, say, McGill, where your sister had gone?
There were probably a couple of reasons. I wanted to be near my family, and it was, I think, maybe an easier school. Since I didn't have the college, undergraduate college, and they were accepting students for diploma.
Mm-hmm.
And that was certainly one reason why it was easier to go to the maritime school.
Mm-hmm. What did you hope to do when you finished social work? You were in at the beginning in 1944. What did you think you were going to be doing when you finished?
I'm not sure that at the beginning that I really gave that much thought. I think I sort of went in knowing that I probably would like to work with children. And always in the back of my mind there was the fact that I had the training in the hospital, that I might be interested in social services in the hospital.
Mm-hmm.
That I considered as a possibility.
Mm-hmm. And later changed your mind,
Yes.
though, I guess.
Yes.
Yeah. As you began at the school, could you tell me a little bit about the courses that you had and the people that you knew then?
There were 8 of us in our class. We were the second class that graduated from the maritime school. And we always thought we had far too many courses. I guess it was really necessary. And there may have been one reason for this. There were so many people who, or the people who lectured, who were volunteers, not paid people. So we did have one person who taught us casework who was on faculty.
Mm-hmm.
And I remember group work, community organization, medical information, law, psychiatry, psychology, rural social work, or rural sociology, I believe it was called. Public welfare, mm-hmm. Statistics.
Mm-hmm. Do you remember any of the people who were doing the teaching then?
Yes, I do. Phyllis Burns was was on faculty, and she taught casework, and later went with the Canadian Welfare Council mm-hmm. in Ottawa. Dr. Prince, very, very active. He was actually the director of the school, and he was a professor at King's College. Dr. Jones taught psychiatry. Dr. Marshall taught medical information. Miss Shan taught community organization. Miss Ward, group work. Dr. Francis Marshall, psychology.
Mm-hmm.
There were others, I'm sure.
A lot of interesting people.
Yes.
And of your classmates, anybody that sticks out in your mind there?
Some of us have kept in touch. Vicki Miller lives in Toronto, and she is still working in an agency there. She's married with grown-up children, and I see her every year or so. There's another girl who graduated with me is doing volunteer work in Richmond, Quebec, and I keep in touch with her. We had one man graduate with us, George Hart, who I think when he graduated, he worked with the Children's Aid Society, then our United Appeal here, and then went on to the Canadian Welfare Council in Ottawa.
I remember the name.
Yes. One girl married a professor from King's, and they moved to California.
Distant place.
Yes, and I believe another of our classmates is still working. She married, and I think she's gone back to work and lives in St. John, New Brunswick. I don't hear from her.
Did you have field placements?
Yes. The first year, my field placement was with the Halifax Welfare Bureau, which was later known as the Family Service Bureau. Two of us had placements there.
What did you do while you were there?
Visiting families who were certainly in need, financially in need, and also families who needed some kind of counseling, whether it was a problem child or with their own shaky marriage.
At that time, that would have been 1944,
Yes.
1945.
Yes.
Who was responsible for what we now call social assistance?
Your municipal?
Well,
The local?
you mentioned that the welfare, as part of your work at the Welfare Bureau, that you were visiting people who were in need. Was that?
Yes. No. It would depend on what they would be eligible for. And if they weren't eligible for assistance through the city, the municipal unit, or if it could have been a person who was eligible for a mother's allowance, then it would be a provincial. Then if they weren't eligible there, then the family or the Halifax Welfare Bureau would have funds to help the family, to tide them over for a temporary period.
So in your visits to these people, as part of your field placement, were you involved in determining eligibility?
Yes. Yes, and the kind of need. Maybe it was just through clothing. Rather than money.
And you did another field placement as well? Did you?
Yes. Now, through the between the years, there were how many months? 3 or 4 months in the summer, where I worked with the Children's Aid Society in Truro, which is a town about 60 miles from Halifax, and that was excellent experience.
What did you learn there?
I learned a great deal about a placement of foster children and working with foster children in the homes, and that was primarily my caseload.
What was the situation like regarding children's aid societies around that time? The time that you began working. Were there children's aid societies all over Nova Scotia that had responsibility for child welfare?
With the exception of 2 or 3 counties, there were children's aid societies.
And how did kids come into contact with the societies, and what happened to them after they had that initial contact?
You mean the children who became wards? The children who were wards of a society were the result of being neglected children. So they were made wards through the juvenile court and placed in foster homes.
At that time, were there large institutions or any size institutions in Nova Scotia, orphanages, children's homes, that kind of thing, or did you have a pretty well-developed foster home system at that time?
It depended on where you lived. There were 2 large orphanages in Halifax, Protestant Orphanage Home and the St. Joseph's Orphanage for the Roman Catholic children. there were also orphanages in Sydney, in Cape Breton. And other than that, you wouldn't have the same kind of resources in the smaller communities.
And the children that you were dealing with in Truro, then, did they have institutions to go to?
There was a small orphanage there that I can't remember ever using it, but there was a very, very small, and I think it was a privately operated one through one of the lodges.
Through one of the fraternal...
Yes, like the Orangeman kind of thing.
Mm-hmm. Mm-hmm.
But that has been closed for many, many years. But I don't recall that we made placements there. Mm-hmm. Because it was so small, I don't think it was available as a really a community resource.
Mm-hmm. In some provinces, children would come into care because of poverty, or because of things like truancy and other reasons other than parental abuse or neglect. Did you see any of that kind of thing during your term, during your placement in Truro?
I wasn't. That period was so limited as far as working is concerned. Later on, I was more conscious of that as I worked with families and or supervised social workers who did.
Mm-hmm. Mm-hmm.
All right.
Sure.
My field placement for my second term was at the Children's Aid Society in Halifax. And then for part of it was with the Child Guidance Clinic, which had recently opened in Halifax.
And what was the work of that clinic?
Working with children who were disturbed, confused.
How was that different from the work at the CAS?
Well, it was more specialized for one thing, and I think it was a good learning experience for certainly for me in understanding behavior of children, and that was valuable for future contacts.
So you were seeing different kinds of behavior with these children at the
Yes.
Child Guidance Clinic then.
Mm-hmm.
Did you have much to do with the parents when you were at the Child Guidance Clinic?
Yes, we would. Home visits. And it was working very closely with the senior social work and with the psychiatrist, and having certainly a great deal of help from them too, as you proceeded in working with the family and the children.
Mm-hmm. Was there sort of a... you mentioned that there was yourself as a student, essentially, and the senior social worker and the psychiatrist. Was it what we now call a team approach to dealing with the child and the family, or?
I think that was beginning. As I look back on it.
Yeah, yeah.
I think we were all sort of starting at that point they were with the clinic as well, and it was early on.
Yeah, the idea of children's mental health was a very new concept at that time, wasn't it?
That's right.
Yeah.
Very much so.
Do you happen to know how the Child Guidance Clinic got started here?
No, I wish I could tell you that. I think just grew out of concern and the need, and the psychiatrists knowing they needed the social work personnel there as well to make it a complete setting.
Halifax has had an institution for treatment of the psychiatrically disabled for many, many,
Mm-hmm.
many years. I know. Was the Child Guidance Clinic part of that, the Nova Scotia Hospital?
No, I don't believe.
Mm-hmm. Interesting.
Mm.
When you finished your field placement then and finished up your course here at the Maritime School of Social Work, what did you do then?
I was employed with the Provincial Department of Public Welfare.
How did that happen?
I went there in '46, and I stayed there till I quit. How did it happen?
Yeah, how did you happen to get that job?
Well, getting a job at that time wasn't difficult. You had many choices.
Oh. Mm-hmm.
I would you not in the terms of the kinds of placements, but I mean there were. I remember 3 or 4 children's aid societies, which we were have been able to work in throughout the province,
Mm-hmm.
who are wanting social workers on their staff. I guess it's because that I really wanted to live in Halifax, and I had done my field placement with the Children's Aid Society in Halifax, and it just seemed like it was a different place to go to.
Mm-hmm.
And I guess knowing people who were already there helped.
Who did you know that was in the department?
Well, Fred McKinnon was the person who employed me, who interviewed. Of course, he knew us well anyway, being everybody knew people so well, and they knew the graduates because he had taught at the school. And the fact that there were vacancies, I suppose, that he wanted filled at that particular time, and wanted to know if I'd be interested in doing it. Some of my friends had already gone there to work from previous years, and so, whom I had known at the school.
Mm-hmm. And what were you hired to do?
I was, I guess you would call it a generalized caseload. And I was responsible for, we called it Mother's Allowance in those days, following up on applications of Mother's Allowance for 5 counties in the province.
You alone were responsible for 5 counties?
For 5 counties.
So,
and I also was responsible for the child welfare work in Digby County, where there was no Children's Aid Society.
Is that nearby Halifax?
No. I traveled from Halifax to Yarmouth, which is a little over 200 miles. That Yarmouth was the last county I had. Mm-hmm. But there were the counties in between for the Mother's Allowance. And Digby County, well, would be about 120 miles from Halifax.
So how would a week or a month unfold for you then? I think that Eastern Provincial Airlines probably didn't go to Yarmouth in those days.
I traveled by car, an agency car. I didn't have my own at that time. So we had agency cars. And at the same time, a friend of mine was going the other direction over Antigonish way, where she did the same kind of thing. So we both start out on a Monday morning with our big caseloads. Generally, I would be away for 2 weeks and then come back to the main office for a week and catch up on dictation and filing. Not filing as so much as getting ready for your next trip out.
In dealing with the people who applied for Mother's Allowance, what kind of regulation or sort of administrative, sorry, I'm losing my words here. What were the rules about eligibility for Mother's Allowance and that sort of thing, and who set them, and who could get Mother's Allowance and who couldn't?
It was a provincial legislation. And during that period, if I remember this correctly, they had just started that a mother whose husband was disabled would be in, if he was unable to work, that she would be eligible to receive assistance.
Mm-hmm.
So that was just coming into effect while I was doing that particular kind of work. Well, there would naturally the mother must have dependents
Mm-hmm.
and under 16 years.
Mm-hmm.
And it would depend on the size of the family and some of her basic needs, such as if she was renting, that you would take into consideration when you would establish or try to establish how much she would be eligible to receive.
Mm-hmm.
And you would make your report, and then it was reviewed by a commission, and they were the people who said definitely that she would receive this money.
So you would go out on your trips and gather the information
Yes.
on these people.
That's right.
And that information would come back here.
Mm-hmm. You would have to see, one thing I remember, it was necessary to see their marriage certificate.
That was another question I was going to ask you about unmarried mothers. Were they eligible?
Not at that time.
Mm-hmm.
No, single parents weren't. No, it was very definite that we must see that marriage certificate.
Mm-hmm. Maybe I'll ask a question about that and then go back to the commission for a moment. What did the unmarried mothers do if they were in financial need?
I believe the only thing they would be eligible for would be municipal social assistance.
And do you know how the municipal social assistance, how they might, what would determine whether or not they receive that?
I'm not sure. I don't recall having any particular cases.
Mm-hmm. Mm-hmm. Regarding the commission, who would make up the commission and how would they have gotten into that position?
They were appointed by government. And I don't know whether it was necessary, but it seemed that it was always 2 men and 2 women.
Uh-huh.
They don't have, I mean, it isn't necessary anymore. They don't, I don't remember when it stopped. But certainly during the period that I was doing Mother's Allowance, they certainly were there.
In Nova Scotia, was there any sectarianism? In some provinces, for example, the commission would have had to have been made up of 2 Protestants and 2 Roman Catholics. Would that have been an important consideration here?
I wasn't aware of it. It could have been.
Mm-hmm. Mm-hmm.
Could easily have been.
Still thinking again about...
Yeah,
go ahead.
No,
No.
sorry. No, I was just going to mention that part of this area is French-speaking, where I worked in Digby County and some areas in Yarmouth County as well. And that wasn't really a problem to me. It was maybe in the beginning when I'd go out one day and do, say, 10 or 12 cases in a day and come back to wherever you were that night, and to get them all straightened out wasn't always easy.
Because of the
At the
language
end of the day. No, it was just name, at the beginning, then everything sort of fell in place.
Mm-hmm. Mm-hmm.
The men always could understand enough English so the application would be completed. The woman, not always. But if her husband was at home, it was easier to do it and communicate.
Another thing about your caseload, Halifax, in any case, has always had a fair number of black people among its population. Mm-hmm. Were there what was then called colored people amongst your caseload?
A few. You would do yes. Some of our children, some of the children that I was responsible for in Digby County were black children who had become wards of the province. And there be, I don't remember them now, but there certainly were mother's allowance cases.
Mm-hmm. And was there any distinction made about their race on any of the processes through which they had to go?
Not that I was aware of,
Mm-hmm.
whatsoever.
Mm-hmm.
No.
In order to help, I'll say us, get a better understanding of the situation of social need and social services in Nova Scotia at that time, the mid to late 40s. Could you describe some of the what were perceived to be the social problems of the time?
I should have known about this before. Do you want to shut it off for a minute? Or is it shut off?
He's just going to turn the tape over. Just takes a second. The reason I ask that question is because perceptions of social problems change, over the years. And in some provinces, unwed mothers were at that time perceived to be a major problem. Alcoholism, perhaps, poverty, perhaps. I just wondered if you had any recollection of that.
I think probably we were more conscious than in contrast with today's society of the very poor housing in some of the communities, and the lack of well, turn it off. Can you turn it off? Excuse me. Particular family problem, or the best way you could, because there weren't the resources there.
Maybe I could ask some specific questions about that, and see what develops out of that, if you don't mind. Around that time, the men would have been returning from the war. I suppose families would have been readjusting to having men at home again. I don't know what happened in this area about the effect of demobilization on your industry and employment activities. So you had that as a sort of a social phenomenon that was occurring, I imagine. What other agencies were around in the 5 counties that you worked in? What other agencies existed?
Just the Children's Aid Society.
That was it. There, in Halifax, you had mentioned there was.
Yes, in Halifax. Well, I wasn't working in Halifax then. It was just from the 5 counties. We call it our Valley Shore.
What counties are those for those of us who aren't geographically
Hants
oriented?
County, Kings County, Annapolis, Digby, and Yarmouth. So if there was any particular concern I would have concerning, a mother's allowance case, and if I was concerned about some problem in the family, I would go to the director of the Children's Aid Society and advise him or talk to him about it. And the other people who were really great resources in the community would be your clergy and doctors, lawyers, public health nurses. So you had these people to talk to because of their knowledge of the family locally.
Were the churches playing a role in meeting social service needs at that time? I
suppose in individual cases. But It was primarily probably using your clergy as references in terms of, you always had to have your 3 references when establishing eligibility for this mother, for a widow who was receiving an allowance. So, quite often they would give their priest or their clergyman's name, their doctor's name.
And would these references be about their moral standards in the community? Is that what they would be asked to give references about?
Partly, I suppose.
Uh-huh.
Mm-hmm. Although it wasn't, I don't think we considered judging a person on that basis. I mean, if she was going to be eligible, and we felt that she could manage the allowance, then
Manage in the sense of
being that it would be done in the best interest of the family, and that you wouldn't need to recommend a person to be a sort of what did they call them? Oh dear, that name's gone completely.
where one acts as sort of a guardian of the funds or trustee of some kind of the money.
That's right. Which would happen on occasion.
Uh-huh. Mm-hmm.
But it would be done on the basis that you, because of her, perhaps her mental ability not to be able to manage well.
Mm-hmm. I understand that in Nova Scotia, up until about 1958, there were what were called county poorhouses in existence.
Mm-hmm.
What did you run into those, and how did they relate to people who, to your clients, for example?
You were conscious of them being there in the community, especially if they didn't look like very warm, comfortable looking buildings. They sort of stood out like, one in Digby County was called the Asylum.
Mm-hmm.
And it just, it looked like that.
Mm-hmm.
Very stark, gray building situated on the main highway. I don't remember using the homes because they were primarily used for the older person who no longer could look after himself because of funds and family were all gone. He would be placed in the poorhouse, I guess it was called.
Mm-hmm.
And the person too who perhaps was quite psychotic and not able to be able, he wasn't, he was beyond control of the family, and he would be placed in the institution as well. And you're very, very low mentally retarded person.
The Nova Scotia Hospital asylum in quotes existed then.
Yes.
But some people would
But some people would still be eligible to go to this kind of an institution.
Mm-hmm.
Maybe psychotic isn't the right word, but fine.
So, again, in my trying to understand how the needy particularly were seen, women who had the appropriate marital status and dependent children were eligible for mother's allowances.
Mm-hmm.
But the single and the elderly poor.
The elderly poor would be eligible for old age pension. It would be there.
Mm-hmm. But
old
yet,
age, yes.
I'm trying to understand how people ended up in the poorhouse.
Oh, I guess it was mainly because their own families weren't able to look after them anymore.
So they might have had financial resources through the old age pension. But
yes, but not having a home to go to.
I see. I see. Amongst the social work community at the time, what was the perspective about the continuing existence of things like the poorhouse?
I'm trying to remember when we no longer had them, and I guess it just comes back to that the social workers plus other people in the community wanted something a little different to meet the needs of the people who required an institutional life.
Mm-hmm.
And to have the people in the institution better trained to care for the people,
Mm-hmm.
rather than just seeing that a person perhaps got 3 meals a day and that would be it,
Mm-hmm.
and not being concerned about other needs of individuals.
Mm-hmm. Sometime during those years, well, from 1925 to about 1949,
Mm-hmm.
anyway, there were a number of crusading social workers
Mm-hmm.
who, and I seem to remember that they came to Nova Scotia too to try and get things like the poorhouse eliminated or changed.
Yeah.
Do you remember any of those people?
No, I don't. And I think the local municipalities too would probably have had a great deal to do about the changes, that they wanted something a little different.
Mm-hmm.
It wasn't always the provincial personnel, but I think people locally were also concerned, your municipal council.
Mm-hmm. Were there things like what we now call advocacy or lobbying organizations in existence in Nova Scotia at that time?
Not that I was aware of.
Mm-hmm. Mm-hmm. I wonder, again, around that time, what particular challenges you faced in the job that you had, that first job that you had as you came out of school?
Well, the biggest challenge, I think, was just trying to meet deadlines. You were just, you felt almost swamped with the numbers of cases that you would have to complete, plus all the child welfare concerns that would be referred to you. That's the part of it. I remember that you didn't have really time to think about other than getting your work well organized and completing the cases before a certain deadline. I think the areas of the work that seemed more challenging and more interesting for me would be working with the child welfare in Digby County, where you would be following up cases of neglect and visiting foster homes, finding foster homes.
Mm-hmm. What would you do in the case of a neglected child? How would you try and make that situation better?
Well, initially you would visit and follow up on the complaint and discuss it with the people concerned, and make some kind of diagnoses regarding what you should plan for the children and what strengths they had at that time in terms of making any changes to make it better, and carrying on from there. If it was a case of desertion, you would have to look after it right away. It depended on the kind of neglect it was. And with the cases of the unmarried mother, it was a different situation where her child was made a ward because she was unable, through misfortune, to look after the child. And I think we were concerned about the future planning of the child who was placed in the foster home. Is there any possible hope of the child being returned to own parents at all? If not, what about a more permanent placement such as adoption?
Mm-hmm.
Those kinds of things you were always working with. We did have one resource which I should tell you about. We had our own psychiatrist on staff who would accompany me down to this county and test children in terms of which was another way of letting us know what's a good plan for the child. Or she might be testing a child we were considering for the Nova Scotian youth training school for the retarded children.
Mm-hmm.
So she was a great help in terms of planning at that time.
Mm-hmm.
Now they referred to clinics, but she was the person in those days who traveled the province
Very
in
different.
testing children.
Yes.
Yes,
Very
before the clinics were set up
Yeah.
around the province. And she was quite a person.
Who was that?
Dr. Eliza Bryson. And she was lame, always had a crutch.
Mm-hmm.
That we had to be sure came along.
Uh-huh. Regarding adoption, that was your concern at that time anyway, strictly in Digby County, is that right?
Well, that would be part of the caseload in terms of planning for children.
Mm-hmm. Mm-hmm.
But later on, I was responsible for adoptions in Halifax.
Yes. Perhaps what we could do is take a bit of a break and then discuss adoptions and your broader
my
child welfare
daycare.
responsibilities,
Yes.
daycare, after a break. Would that be
Fine.
all right?
Very good for me.
Okay. resuming our interview in Halifax with Miss Isabel McClellan, and we've been talking about your work with the Department of Public Welfare from about 1946 to 1949. When you finished that work there, you moved on. What was your next job?
My next job, which I had for approximately 3 years, was working with the unmarried parents and adoption placements for the Halifax area. And during that period, we also did a number of placements in the city of Halifax as well.
Mm-hmm. This was as part of the Department of Public Welfare.
Yes,
still?
That's right. Yes.
What level of need were you seeing then as far as adoptions and unmarried parents went?
I'm not sure what you mean by level of need.
Sorry,
in this respect.
My question wasn't clear. Were there a lot of adoptions to be done, a lot of unmarried parents?
There were many babies to be placed, which is entirely different than it is today. People did not wait that long for an infant. We work very closely with the Protestant maternity home, where most of our unmarried mothers would be placed during their pregnancy. And close association with the Home of the Guardian Angel, where the Roman Catholic girl would be staying. And I also remember during this period, we began using more risks in terms of adoption, that we were placing the child at an earlier date. And that they didn't wait until a year or two to make sure that how the child would develop. More emphasis was being placed. Oh yes, I was talking about is it on now? That we were starting to take the risk in earlier placement of children. And which was actually beginning before I started this particular job, but we certainly continued it. And we're happy with the results, and that children were placed with their new family at an early age.
At that time, did most unmarried mothers go to either the Protestant or the Catholic maternity home during the period?
Yes, a few would have a contact with a particular friend in the community, or very few would have sufficient means to stay on their own with an independent living.
Were you dealing with women who were mostly from Halifax itself, or were you getting women from all over the province?
Most of the people came from out of town. Because that's one reason why they left home, is to come to an area where they weren't known, to have their babies. I must say we had wonderful cooperation from the gynecologists, who would quite often see the mother, and they would refer to us. Rather, I mean, it would have been so easy for them to have thought, well, this would be a lovely baby, I know a family, and do a placement privately. But I must say that we had very, very good cooperation from the doctors, as well as the pediatricians who would examine our babies pre-adoption placement. And they became very interested in our program and what we were doing.
At that time, the Halifax Children's Aid Society had been in existence for a fair number of years. Did they have an interest in adoption services as well?
Yes, they did. And they were beginning to make more placements as time went on, and eventually took it over completely for the city of Halifax.
I see. Did you have trouble finding homes for adoptive children?
Not for infants, particularly infants who were healthy and not no health problems or mixed racial origin. Perhaps a little harder for the child who was older. And there weren't as many Roman Catholic homes as there were Protestant homes. So we had our little Catholic infants would wait longer for adoption placement.
Did Nova Scotia, were Nova Scotia children placed in Nova Scotia homes?
Yes.
Some provinces seem to have difficulty finding adoptive homes and shipped. Sorry, I'm using the wrong terminology here. Children were placed in American homes. Many children were placed in American homes.
I think later on, our department set up the adoption registry. And for those children who were where we weren't able to find homes for them in our own province, then they would be referred outside. But it was only on the basis that there was no home available for them in their own province.
But that wasn't a frequent occurrence then for Nova Scotia kids?
If it was later on, for especially kids who were older.
Oh, I see.
Yes.
I see. So infants then were relatively easy to place?
Yes.
What about special children, disabled children, the multiracial mixed children?
We were working with these particular children, not when I was responsible for the placements myself, but more when I was supervising workers. And this would be a few years later, when we became or felt comfortable about placing children with problems, whether it was a physical problem or a mixed racial origin, and helping adoptive parents look at what they really were considering an adoption in a different way.
So part of the job that you were doing was educating people about the advantages of different children. During the time that you were involved with adoptions and unmarried parents, did you see a change in the number of children, the type of children, and placement of children?
I wouldn't say in the 3-year period that I was doing it particularly, but later on, we were more conscious of it. That we were, because you felt comfortable and successful about a certain placement, then you were encouraged to continue and do more of the same kind. And it depended a good deal on your own staff and their skills and what they were able to do as well. One thing I'm sure that has changed, the ages of the unmarried mother. When I was doing it, you would find that it would be late, well, from 18 and into the 20s, where now it's the lower age group of unmarried mother.
Many more teenage pregnancies. Yeah.
Where it would have been rare at the time when I was working with them.
As well as the adoption of the child, what kinds of dealings did you have with the mother after the child was born and placed?
You would certainly see her up until the time of placement of her child. But once that procedure was completed, unless she particularly wanted to come back or felt that she had things she wanted to discuss with you, then you would feel that was completed as far as your case was concerned in dealing with individual cases.
Were there people, colleagues, or others in the community that you worked with at that time that particularly stand out in your mind?
Certainly, the matrons at the Halifax Infants Home, and you would get to know the president of the board. You know, the maternity home was operated by a board. As a matter of fact, this painting over here was presented to me by a president of the board of the Halifax Infants Home, just to say thank you for helping our girls. That's when I was leaving that particular time. But and then you knew the sisters very well at the Home of the Guardian Angel, because if we had a girl we wanted placed in their institution, then and they were very conscious of their cooperation.
At that time, was there the social work community in Halifax and in Nova Scotia? Were there many other trained social workers besides yourself?
Not when I started out in 1946. Our Association for Social Workers would probably be 20 or 25 people, if that. But at the time, it didn't take very long because of the School of Social Work, and each year the classes were getting bigger. So you noticed the difference.
Was there an association at the time in 1950 or so?
Yes. At the time I graduated, there was an association, and I remember being secretary.
Do you have a recollection of what kinds of things the association was doing at that time?
One thing they were working on was the old, what did they call those laws? The poor, my dear, Dr. McKinnon will tell you about this. I think I would remember. But they were very concerned about the kinds of laws at the municipal level and getting the legislation changed to make it easier. I think it was a matter of there were very small districts all over the province, and they wanted to make them larger, so there would be less. Well, they could be quite punitive in one area, one little tiny area of the province, where if they had a larger municipality, this would be of benefit to more people.
And it was still.
And I remember our association working on this.
And it was still some years after that the province took major responsibility in the area of social assistance.
Yes.
You decided to leave or to move along, I guess, from your job with unmarried parents and adoptions. What happened then?
I was the appointed assistant supervisor of our, it was called then the Halifax District Office, and this office was responsible for all the child welfare work in Halifax County, including Dartmouth. And we still had the Mother's Allowance workers working in that office as well, but I wasn't responsible for those particular workers. later the office became a regional office, and with the staff twice as many people.
In becoming a regional office, did that mean that there were additional responsibilities for you?
No, I don't think so. I seem to have the same kind of responsibility, which is supervision of the workers.
Mm-hmm. So was it the geographic area that
Yes.
changed? I see. In your work as assistant supervisor for the Halifax County office, did that include the city of Halifax too?
Only for some areas of work we would be responsible for, and that would be the mother's allowance, anything that was the responsibility of the Department of Social Services, provincial.
Mm-hmm. What was different about your work as assistant supervisor than what you'd been doing before?
Well, I suppose it was interesting in terms of watching the development of certain workers in their jobs and what they were doing, and working through any problems that they would have on particular cases. And excuse me. And it was during this period where our agency was very much involved in supervision of the students from the School of Social Work. And this was always interesting. Excuse me.
You had students who were placed with you directly?
Yes.
What kind of ideas would you try to instill in those students?
I don't know if it was a matter of instilling or just through the supervision of work that they were assigned, that you would help them do or work out what seemed like a good plan if it was working with placement of a child. And there was a lot to do with their attitudes and the way they would look at things. And trying to improve isn't really the word I want, but so that their skills were used in a better way.
Mm-hmm. Mm-hmm. During the period of time, it had been what you finished school in about 1946 or so, and finished your work as assistant supervisor in 1967. Over that approximate 20-year period, what changes do you remember in the existence of various social services?
Well, I think the thing that really stands out was the great development of services throughout. Within our own department, there were so many more workers, and there were so many more resources in the communities than there were when we started. These are the things that, to me, sort of stand out.
Mm-hmm.
And I think all the time the fact that there were more trained social workers in the various communities. I think looking back, when we started out, you certainly you felt a great feeling of well, you were so attached to the small group of people. You were so integrated. And there was great loyalty, which I think perhaps you get away from that as you grow bigger.
Mm-hmm.
You just don't always carry that through in the same way.
As the size of the department
Yes.
increases, or the organization.
Yeah,
whatever.
you lose the sort of close-knit kind of relationships you had when you were a smaller group.
Did you find that maintaining a support system amongst your colleagues was something that became more difficult then as time went on?
I'm not sure that was it so much as that perhaps everyone was more interested in what they were doing in their little place rather than, always that interested in what other people were doing so much. They became very sort of not ingrained in their own particular interest.
I'm thinking.
You know what I mean?
Well, I'm thinking back to what you were saying earlier, or what we were talking about earlier about a team approach, the beginnings of a team approach.
Yes.
And wondering how much of that kind of working together to help a family or individual you were seeing later on.
Yeah. Now, I'm just thinking about that now. I know we do, thinking about case conferences with psychiatry or a child guidance clinic, just around planning, making the best plan. It could be for an adult or for a child. This, was excellent.
Mm-hmm.
And I'm sure it's still going on, but you could rely on people to be with you in terms of trying to work out a good plan for children.
One of the social phenomenon that occurred in many places in the country over those years was an increased professionalization of social work, where fewer volunteers or formally trained staff were involved, and an increasing amount of bureaucratization, where tasks were made smaller and more clearly defined. And I'm wondering if those things, if you saw an effect of those kinds of trends in your work.
I can't think of anything really. Sorry.
Regarding specialization, or not specialization, professionalization, did the provincial or the national and then the provincial association of social workers make any moves toward licensing or registering social workers during that period?
Certainly, locally we did, in terms of registration for social workers. And I can't tell you the year. It must be mid-60s perhaps, maybe a year or two later, that legislation was passed and we were able to register social workers in the province. And that all came through our local CASW.
That was something that you advocated for.
Yes.
Did that involve getting the provincial government to pass legislation?
Yes. Mm-hmm.
How did that process work?
Well, I wasn't, I know I went to meetings. I wasn't on the committee who were actually doing the groundwork for it all. But I remember it was a matter of having, I would think, consensus, as I recall, of the social workers in the province. And it meant that this committee would meet with the various social workers around the province before, and then they would had an outline of their the legislation, which I'm sure a lawyer would be helping them with. And then it was passed in in government.
Was government anxious to have that kind of licensing?
Well, they certainly went along with it. I don't recall that there was any opposition.
Had there been any kind of precipitating factors that meant licensing or registration became more important?
No, I think one important thing was the fact that it meant more recognition for the profession.
Mm-hmm. Mm-hmm.
Would be a big thing.
Additional credibility.
Mm-hmm.
Yeah. Yeah. Drea.
Now, not all social workers, some social workers don't belong to the association, so if they don't belong to the association, they're not registered.
Mm-hmm.
But they still, I mean, they still have their degrees,
Mm-hmm.
Master in Social Work, but they don't necessarily belong to the association.
What do you think about that factor?
I have always felt very strongly that all social workers should belong to the association.
Mm-hmm. Would you suggest any action for those who don't join?
No, I know there have been some thought, and it would be brought up at meetings every once in a while, that agency only employ those who are.
Mm-hmm.
But that has never come about.
No. Again, about your work as assistant supervisor of the Halifax district office. What were the challenges that you faced during that particular job?
I don't know whether you call this a challenge or not, but you always seem to be. You would get social workers on your staff, and you would go through the preliminaries of orientation, and they would be with you a year or two, and off they go. And you would seem to be doing it again, all over again. So, there was this continual, that wasn't always that easy. There were some reasons, reasons why workers would leave, getting married and moving to other agencies and this kind of thing. Or promotions, so you expect it, but this seemed to be a continual grind in terms of supervision of staff.
Mm-hmm.
I like to think of regular staff meetings and doing things and having social workers participate in conferences and that kind of thing.
Mm-hmm.
Which made the job more interesting for them. And having students in the agency, I think, in some ways was more work. But it was was kind of, I always thought of them as being your future social workers that someday would come back and work there.
Mm-hmm.
But they always added an interesting dimension to the agency in terms of their enthusiasm and
Mm-hmm.
what they were doing.
Yes, I found anyway that sometimes students ask such good questions.
Yes.
It makes one think.
Yeah, that's right.
A little more. You left that job as assistant supervisor and took on a different, or I assume a different type of responsibility.
Yes.
What did you do after you left?
I was made the supervisor of daycare services for the province.
And how did that come about?
Well, I think our main, we consider our main office, the people who are in administrative positions, knew that I wanted to change, for one thing. It just came at the right time when legislation was being passed, and they asked me if I would consider it. So I said I would.
What was the situation of daycare services in the province as you began that work?
Well, I guess it was various reasons why the legislation was felt necessary, because of the public concern and various agencies' concern about the existing daycare services that were overcrowded, and safety of children, fire and health, overcrowding. So probably I'm going to say the Welfare Council had something to do with getting things started. Anyway, there was a committee that met regularly in terms of getting the legislation ready to be passed, and there were various meetings with the director of daycare services for Ontario, who would come down and help in terms of many things, and so our legislation was patterned pretty well on what they were doing there.
Who was the person who came down? Do you remember the name?
I wish I could remember her name. She was just so nice. She later retired, but she was so good. I spent 2 weeks with her in their office prior to taking the job.
Mm-hmm.
Just won't come to me.
Mm-hmm. The Canada Assistance Plan had passed at the national level a year or so before you were appointed as supervisor of daycare services. What was your impression of the impact of that legislation on your new job?
What do you mean by that legislation?
The Canada Assistance Plan.
Oh. I don't see that in relation to daycare. I'm sorry.
Mm-hmm. Yeah, I understood that it provided part of the funding for daycare, but perhaps it didn't have much of an impact here.
It may have later on when daycare was started. I mean, it was all privately owned. Now, whether that made any difference, I think it probably did.
Mm-hmm.
Where there was no government input at all.
Yes,
and and I think that's why I'm not familiar with what you're talking about. So in the beginning, it was just a matter of identifying where these places were, and once they would make and inviting them to make application, then processing and helping them upgrade enough so that we were able to give them a license. That was all very basic. And a lot of the work during the first year was around interpretation and going slowly in terms of giving enough time for them to make changes so that they would meet the regulations. Now that was for probably a period of 3 years, and then government came in where legislation was passed where they would be able to pay subsidy to certain daycare centers that were not private but public and operated by boards. And it meant that anyone using that particular center would help with the fee if they weren't able to pay. So that would be paid through the help of government, depending on their salary. And most of the people who were eligible to receive this kind of help with their daycare fee were single parents.
So that would have been where the Canada Assistance Plan funding would have come in.
Yeah.
Not realizing that the daycare centers were all private.
Yes. Right.
The reason for my error there. Were you involved then in encouraging the development of additional daycare services?
Yes. Certainly in the area of the what we think of as the public daycare centers. And that mushroomed. It really did. Several in Halifax, Dartmouth, and most towns have their daycare centers.
And did you cover the whole province?
I covered the whole two, and then about 1970, when the legislation came in for the public, another person came on who was appointed the director of daycare and had more responsibility for the administration of daycare and this kind of thing. So there were two, but we covered the province.
So was your work a lot in program development then, rather than administration?
A good deal of it was, well, even visiting the people who wanted to open. That took up a lot of your time, and those that were open, to encourage any training that was available, to upgrade the staff. I mean, this was pretty important in terms of the job.
How had things changed over the 30 or so years that you had been a practicing social worker?
Society has changed, so which has made so much that's, I guess it makes different kinds of problems. People are, well, just in the daycare services, to the fact that so many of these people who need the service are single parents, and that I wouldn't have thought was very evident in 1946.
A difference in number of women working?
The necessity for it in terms of meeting standards of living, even if it's a two-parent family, then it's a matter of finding, for them to find a suitable place for their children while they are working. And it is quite, that wasn't happening.
During those years, perhaps you'd have to do this from the vantage of today's perspective. What kind of changes did you see in the idea of who's responsible for meeting social need?
You're kind of thinking about social need in terms of...
Thinking of the social assistance, daycare,
yes.
child welfare.
Well, thinking about where I'm sitting now, it seems to me people have become quite dependent on social assistance, regardless of what it is, whether it's unemployment insurance, for instance, or help with their daycare need. And I'm not so sure that, I think sometimes people could do more for themselves if it wasn't so easy, perhaps, if it wasn't so available.
Does social work have a role in there anywhere?
I suppose when you think of casework and things you learned about how you help people to help themselves, there should be a role. I think to me, it's a harder society for people to live in now. There are more stresses, so many people live under stress. So that brings the different kinds of problems,
Mm-hmm.
which I don't think we were that conscious of a number of years ago.
Mm-hmm.
But how the social work role fits in there, it seems to me it's a very wide, complex kind of situation.
Mm-hmm. If you were starting out again today, what would you think you'd need to know before you could start again?
I think I'd have to change my a few attitudes a great deal in terms of trying to be, to understand the kinds of problems that you would face.
Mm-hmm.
Then I think you have to do a lot of thinking and adjustments in terms of the way you um, you have sort of a stereotype feeling. Then this would have to be changed.
Mm-hmm.
Um, I think it's difficult to work with people who I think who become very angry about the way they have to be or the way they're living, and they really have quite good reason for feeling that way.
Mm-hmm.
But so I think it would be around changing your own attitudes, plus learning a lot of different kinds of casework skills in order to be able to help people in this society.
Mm-hmm. As we're moving toward a closing, I'm wondering if there are accomplishments that during your career of which you're particularly proud.
Well, I suppose I could always take some satisfaction in being the person who got daycare services started, for one thing, and I think the work with adoptions have a very special place for me in terms of looking at adoptions in a different kind of way, rather than always thinking you had to place a perfect child with parents. This, I feel, that developed during the period when we were working with adoptions, and then went beyond, where other workers certainly did a great deal more.
Mm-hmm.
I'm not sure of anything else at the moment.
Mm-hmm. Well, in closing, then, I wonder if there's anything that you'd like to mention that you haven't had a chance to do thus far.
Well, I think about the kinds of things that social workers, if they want to, there's no lack of organizations you can become involved in terms of that are very closely associated with social work. And I know I had a number of offices on our local welfare council, being secretary to certain divisions kind of thing. And I was a member of the board of the YWCA for 10 years and chairman of the personnel committee, which was an interesting experience. And I was on the board of the Provincial Association for the Mentally Retarded for 10 years. It seems longer than that. And I became very involved and very, very interested, because you become quite closely associated with the parents themselves and their dedication with the kinds of programs we were trying to develop to make it easier for the children. And in that, I was chairman of the provincial home care programs, which I found very interesting. I still maintain a little interest there. I keep thinking I should do some volunteer work with that particular association, but I haven't. I have done some volunteer work with the Meals on Wheels.
Uh-huh. So you can continue your work on in a volunteer capacity.
Yes, very slightly. I've become more interested in other things not related to social work, and I've done a fair amount of traveling. So when you do that, you can't always be at home.
No, indeed. Hard to go to committee meetings when
Yes.
you're far away.
Yeah.
Well, in conclusion, then, I would like to express my appreciation to you for the time you spent with us this afternoon. I found it very informative and very enjoyable. Thank you very much for spending your time today.
I've enjoyed doing it.
Good.
Brought back many memories.
Pleasant, I hope.
Mm.
Thank you.
You're welcome.
To describe that, and then it'll go on to the tapes.
Oh, okay. You know her, don't you? Oh, well, this picture, I the one you like,
Okay.
is done by a local artist. He's an Anglican clergyman, Alan Sagar, and he's married to a social worker, Elizabeth Bissett Sagar, who is actually doing, she's the director of daycare services now for the province.
And perhaps do you want to describe these and
Can you get that? Isn't that nice printing on? Look at the dust.
may have to hold this in a way that
You tell me. You don't need to use this now if it doesn't look good, if it's kind of corny.
no, we won't use them if they don't fit.
No.
It's nice to have more than we need than less,
Yes.
because we can't come back, to do
No.
it again. So, is that at an angle that you can get it, Don?
Well, more or less, yeah. Would you like to describe?
Oh, this was presented to, I believe there were 4 of us at one of the closings, graduating closings of, well, it was in 1963, the Maritime School of Social Work. And it was presented for those field instructors who had spent, I think, more than 12 years supervising students for the school.
Mm-hmm.
And they felt that we should be recognized in this way.
Mm-hmm.
I think there were 4 of us at that time who had supervised for that number of years. Now, you don't want that, do you?
Oh, well, sure.
Now, this is just a diploma. This is the diploma I received when I graduated from the Maritime School of Social Work in 1946. And it has Phyllis Burns and Dr. Prince and Judge Hall and Dr. Fred McKinnon. And it's very dusty.
Did you describe that picture as well? Was from
Yes, from Mrs. McGee, who presented it to me.
I'm going to walk it from here. Move this over here. We're going to do the down
In appreciation of work that I did with the unmarried mothers at the Halifax Infants Home, the old house. It's not called that now. It's run by the Salvation Army. She moved away. As a matter of fact, she gave it to me as they were moving away.
When was it that you received that?
Well, it would be around 1951. Okay. Oh, great. That's all, huh?
If you want it.
Describe that one. Do you want to describe that one?
Oh.
Because that one was.
That
You
was
left the department?
when I left. Yes, they presented me with that when I left. When I retired. When I retired. You're going to do this with Fred McKinnon too, Charlie's
Yes,
meetings?
yes, we are.
We went to it. My cousin did the one over there. We'll talk about it.
Absolute spaghetti is what we have here.
I think we're probably
You don't need to, we don't need to do this. I'm
With a camera.
This picture was presented to me when I retired in October 1979, 78 rather, and it was painted by a social work friend, Frida Vickery, who for many years was director of social services at the Children's Hospital in Halifax. And after her retirement, she did a great deal of painting